You are aiming for a bullseye. In scenario A, your shots are scattered, but one hits the center. And in scenario B, all your shots hit the same spot, but it's not on target at all. Which one is better? Is it accuracy or precision? A lot of people think accuracy and precision mean the same thing. But in science and data analysis, they are actually very different. By the end of this video, you will know exactly how to tell them apart and why it matters. Accuracy is how close your measurements are to the true value. For example, if your true blood glucose is 90 milligrams per deciliter and the machine reads 91 milligrams per deciliter, that's accurate. A test with very low accuracy might give a blood glucose reading that is much higher or lower than the true value. This usually happens because of machine errors, such as improper setup. Human mistakes can happen too, but they are rare if the technician knows what they are doing. Both problems can cause repeated wrong results and incorrect diagnosis. Precision is how close your repeated measurements are to each other. If your bathroom scale is broken and always shows 5 kilogram less, it's precise but inaccurate. In medicine, a test that is precise but not accurate can make people trust the results when they should not. In biostatistics, we always check both accuracy and precision. Results can be accurate but not precise. Precise but not accurate. Sometimes even both highly accurate and precise, or neither accurate and precise. This means there are 4 possible situations. So, how does all of this connect? For the first situation is high accuracy but no precision. This means your results are scattered, but the average is close to the real value. For example, if a patient gets vitamin D test results of 10, 50, and 90 nanogram per milliliter, the average is 50 nanogram per milliliter, which is correct. But the results are very inconsistent. This can happen with devices that only work properly sometimes. Statistically, the data are spread out with a very high standard deviation or variance. The second situation is no accuracy but high precision. This means your results are close together, but the average is far from the real value. For example, a miscalibrated blood pressure monitor might always read 147 over 86 mmHg, even though the true value is 121 over 83 mmHg. This is risky because high precision can make you trust the result unless it is clearly wrong or cannot be repeated on another machine. The third situation is high accuracy and high precision. Here, your measurements are both close to the real value and close to each other. This is the best case because there are very little error, results you can trust, and easy to repeat. For example, liquid biopsies can check blood for tumor DNA, giving very precise information about genetic mutations and helping doctors to choose the right treatment. The next situation is no accuracy and no precision. This means your results are far from the real value and not close to each other. This shows the test is neither correct nor reliable, and the numbers are basically random. For example, if a patient's real blood pressure is 120 over 83 mmHg, but a broken home monitor gives 3 very different readings. That is no accuracy and no precision. So why is this considered no accuracy and no precision? Because the average isn't close to the real value, which indicates no accuracy, and the readings change a lot, which shows the device is not reliable, and that indicates no precision. In summary, no precision is easy to spot. The main situation to watch out for is high precision and no accuracy. But why does this matter? And that is because sometimes your knife could depend on it. If a test isn't precise, you could get different results each time you take it, which makes diagnosis really difficult. For treatments like chemotherapy or blood thinners, even a small dosage error can be very dangerous. That is why accuracy is so important. Precision medicine means care tailored to you using both accuracy and precision. To summarize, accuracy means getting the right answer, like hitting the bullseye. Precision means being consistent or hitting the same spot every time, even if that spot is not the correct answer. Medicine needs both accuracy and precision to keep patients safe and treatments effective. That's it for now. Thanks for watching.